feel like that is an interesting part of the story.
So, any particular character that highlights sleep disturbance in Wes Craven's Nightmare?
Tina. Tina?
Is that her name?
Nancy? Or Tina?
Nancy,
Well,
yeah.
Tina has a problem.
Yeah.
She's the first victim.
Yeah.
Is that who you mean?
Yeah.
All right, so Tina. So what's going on with Tina?
She's having what I want to say night terrors, but I'd say more like nightmares because she remembers them. Like night terrors you don't remember.
Yeah, that's a problem. So I think while sleep terror disorder would be, I think an initial consideration with regard to a provisional diagnosis, the fact that Tina does recall the dream would strongly suggest that it occurred during REM.
Mm-hmm.
And if that, or with that being the case, this is a nightmare. So sleep terror disorder, I do not believe would be the single best diagnosis here, the single best answer. All right, so if not sleep terror disorder, then what? So a disturbance of REM, I have no problem with that, which would include what differential diagnoses then?
Rem sleep behavior disorder.
Yeah, I think that's top, right? That's pretty high on the differential here.
Things are moving quite a lot and acting things out.
Yeah, she's acting things out. She's got some help, but then again, she wouldn't be able to convince you of that if you were on call tonight. By the way, I'm on call tonight, so I know if I were supervising you, if you described to me what happened to Tina, I think REM sleep behavior disorder would be high in a differential diagnosis. Now, during REM sleep, you have muscle atony, meaning that you have muscle paralysis, right? However, due to a dysynchrony with regard to the phases of sleep, people during REM may maintain muscle tone. That's abnormal. And while it's considered to be a quote-unquote normal variant, it could lend to pathology. And one example of pathology it could or serves risk to developing is REM sleep behavior disorder. That is, during REM sleep, individuals behave in such a way because they have intact muscle tone, which is, again, is itself abnormal. We should be paralyzed during sleep, aka sleep paralysis is the norm during REM sleep. But yeah, I'd be concerned that she's obviously in REM because she's dreaming. And yeah.
I was going to say you could make you want to make sure the patient doesn't have any dangerous objects near them, or like the mother made a comment like trim your nails or something, which is like how scratched up her clothes were initially. So I thought that was funny, like parallel to how you can actually try to.
It's a great point. Yeah.
Track the safety of these people.
That's a great point. Yeah. So yeah. Make sure the individual, and this would be referred to in psychological management as stimulus control, and that is just make sure the environment is safe so that with any dysynchrony and the individual maintaining muscle tone during a REM period, they are less likely to hurt themselves. Right, so REM sleep behavior disorder in Tina. Anything else we should consider here? And the answer would be, as a hint, another REM pathology.
So nightmares or something?
Yeah, right? There's a condition called nightmare disorder.
Mm-hmm.
Right? What is nightmare disorder? I mean, the title kind of gives this away. Nightmare disorder are frequent reoccurring nightmares that cause clinically significant distress or impairment. Do we think Tina is in distress? Yeah, kind of. So to the extent that this was not a one-time thing, then I think we have to consider nightmare disorder as another diagnosis for Tina. Anything further? Any other characters you want to discuss other than Tina?
Okay, I guess say for all of the children who were having these symptoms, it was kind of like they were having some like hypnagogic conflict, sort of like, I guess they weren't hallucinating in the movie, but you could say that they were seeing, like they said they were in REM, but it was really quick. I don't know how to describe it. So like they were waking up, they were still seeing the delusion sometimes. Freddie was actually there, which you could say is, and they woke up and the delusion's still there. Maybe more like a hypnotic sort of thing.
Yeah, right. So we might think that any one of these characters is experiencing visual hallucinations, the boogeyman. And if those visual hallucinations are occurring upon falling asleep, the neurologic term that is used is hypnagogic hallucinations. Hypnagogic are those hallucinations, those perceptual disturbances that are experienced upon falling asleep. And they differ from those that might be experienced upon awakening, hypnopompic. Right? So those are two neurological terms, certainly two terms in sleep medicine, that are often used to describe the timing of visual hallucinations, that is perceptual disturbances, either falling asleep or upon awakening. Hypnagogic and hypnopompic. And that might be going on there. Now, anytime an individual has a visual hallucination, resist the temptation to attribute it to a mental disorder. Okay, visual hallucinations are much more likely to be, quote, organic, end quote, in pathology. So we should be worried about substances, and we should be worried about underlying medical conditions. Right, so, psychiatrists always have to keep that in the differential and high in the differential. And that certainly is true in this case as well. Especially now that we see, pardon the pun, visual hallucinations. If Tina, or anybody else in this movie for that matter, presented to us with recurrent nightmares that were recurrent, causing clinically significant distress or impairment, we would still think organic, because that's the way psychiatry must think. But now when we add in the additional information of visual hallucinations, our concern with regard to organicity, with regard to another medical condition, and or the direct physiologic effects of a substance is now exponentially increased.
And then if you had like a whole street full of children presenting with the same sort of issue, would you be even more concerned, just thinking it's like an environmental toxin?
Yeah.
At that point?
Yeah, the fact that 4 individuals are coming forward with the same symptoms is very concerning.
In the same area.
That there might be some environmental exposure. Yep. Anything else about Tina? Is there any evidence of drug use in this movie? And these characters are all young, they're adolescent. Now, not that adolescents can't become ill, but certainly without any overt evidence, the likelihood of there being a medical condition explaining all of the above is rather unlikely. But to your point, it does grow more concerning because of not the 2, 3, but the 4 people that encounter these same symptoms at the same time.
Well, and the other thing is it plays on the same trope that Halloween does, where Tina and her boyfriend are sexually active and she's the one who gets killed, versus the survivor who's like more, at least more cautious, because at first she's like, oh no, we can't, we're here for support.
So 2 potential screening tests here would be HIV and an RPR with regard to unprotected sex, linking to the medical condition that might be explaining all of the above. For neurosyphilis, I think the timing is way off here. How many years does a TREP infection need before it actually goes to tertiary or neurosyphilis? I mean, it's not a year or 2, right? I mean, so I don't think that fits here. HIV encephalopathy might be different, but I'm not so sure an RPR is going to be of high yield for us. Again, these are 2 infectious agents that could infect the central nervous system and result in behavior similar to what we see in this movie, including those visual hallucinations. The problem here is that Nancy sees it too. So, fits with the trope, it doesn't fit with...
I guess that she survives is more fits the trope, sort of.
Right, oh yeah. So she's the final girl, yeah. She definitely fits the trope. She doesn't fit our differential.
Yeah.
Well, let's talk about Nancy then, since we're talking about Nancy. What else? I noticed that she's taking stimulants.
Oh, caffeine.
Yeah.
Right.
So that caffeine can induce. Well, let me just take a step back. When we talk about substances and substance-related disorders, we talk about, number one, substance use disorders. And the substance use disorder criteria set applies to any substance of abuse, including caffeine. Right? That's the criteria. So that criteria set, I can post it later, is the acronym of Clippity Clop. One of your classmates, former classmates, actually created a YouTube video to review the various signs and symptoms of substance use disorder, whether it's alcohol use disorder, caffeine use, etc. Right? So that's the use disorder. Now, once that's established, we have to also be concerned about substance-induced disorders as well. That is, the substance-induced disorders come in multiple varieties or examples. Number one, intoxication. Number two, withdrawal. And number three, substance-induced mental disorders. I think caffeine intoxication is readily straightforward. It looks similar to stimulant intoxication. However, there are a couple of signs that are not included in the general criteria for stimulant intoxication. What are those two that you can look at in a case vignette on a shelf exam and then identify as caffeine intoxication instead of stimulant intoxication?
Is it like urination, increased urination?
Good. Diuresis.
Yeah.
Diuresis does not appear as a clinical criterion for stimulant intoxication. It is listed in the caffeine set. There's one more. Flushing. Okay, facial flushing. Caffeine withdrawal, I think, is relatively straightforward. I don't think anybody, especially anyone who drinks coffee, would need to be reminded and therefore have this reviewed to identify in the shelf exam. Of course, headache is a significant and very, I think, sensitive criterion, irritability, etc. But then there's the caffeine-induced mental disorders, and there's only two of them. Caffeine has the fewest, next to tobacco, the fewest, because tobacco has zero. Yes, tobacco has withdrawal, but tobacco has no identified induced mental disorders linked to it. And caffeine only has two. What are the two mental disorders that caffeine can induce?
Psychosis?
Psychosis? No. No.
Mania?
Mania? No.
Anxiety?
Louder?
Anxiety?
Anxiety, yes. There is such thing as caffeine-induced anxiety disorder. And there's one more. It's insomnia.
Are
So,
they relatively common? I mean, like, because everyone's drinking coffee, right? So
I think it's much more common than the point prevalence may indicate in the literature. Yeah. So, why isn't, or is, a Nightmare on Elm Street a case study of caffeine-induced sleep disorder, insomnia, and its main character, Nancy Thompson?
Well, because doesn't she only start drinking the caffeine after she starts to display symptoms?
Yeah. Yeah. So the temporal relationship is not there, even though the physiology makes sense. Be very careful on shelf exams. The physiology can make all the sense in the world. By the way, a little test-taking pearl is that the physiology is always correct on the shelf exam, very infrequently. especially when you deal with medical conditions. Will you be provided a medical condition that can't induce the presenting symptom that is in your vignette? Substances do take a little bit of memorization. But despite that, even if you understand that caffeine can in fact induce anxiety, the temporal relationship does not make sense. And therefore, a caffeine-induced sleep disorder is not going to be higher in a differential here for Nancy Thompson.
I know caffeine or other stimulants can help with narcolepsy. She's not quite. It seems like again the cause of her sleep disorder was not. It seems like there is a cause other than like narcolepsy, but she is presenting some of the symptoms with like the hypnagogic, and also her Rem latency is reduced. I think also. Like she actually had a whole sleep study where she fell asleep quickly and started having.
I think I timed it as 23 seconds.
That's super low.
That is pathologically low.
Yeah.
Yeah. So when we talk about REM latency, is the duration of time it takes someone between falling asleep and going into their first REM cycle. Okay. And in this case, it is way too rapid. So that is consistent with narcolepsy. Now, if we saw this on the polysomnography, if you got the results, what is the next step in terms of verifying the diagnosis? Since it appeared to me that the polysomnography had to be terminated prematurely. How about if I rephrase the question, especially for shelf exams? What is the diagnostic test that you would order if you suspect narcolepsy?
And this a sleep study where no.
It's a multiple sleep latency test.
Oh.
Right? Anybody know what this is? A multiple sleep latency test. This sounds mean, but it actually is I'm sorry, not therapeutic. It's diagnostic. An individual comes into a sleep lab and they're given about a 15 to 30 minute nap and then they're woken up. And they're allowed to go back to sleep and then they're woken up again. And then they're allowed to go back to sleep and they're woken up again. And during the episode, whether it's during the day, during the night, during the episode that they're in the lab, if they go into REM, 50% of the time it's pathological. So they're given a series of mini naps, and they're always woken up by the tech. And then you read the results, and if they actually get into REM, half that time it's considered to be diagnostic for narcolepsy. Now, it wasn't intended because they ordered the wrong test. But because of what happens, they end up doing a multiple sleep latency test. All right, so it's an inadvertent MLST. And she rules in. Now, we want more. We don't just want a single cycle. But she actually does rule in. So narcolepsy looks like it might be a diagnosis. We also understand that she has both hypnopompic and hypnagogic hallucinations. Narcolepsy certainly could explain those. Is there anything else about what she is demonstrating that may be consistent with narcolepsy? When is its onset?
During the daytime as well.
I mean age.
Oh.
Adolescence. Right. So I don't know if Wes Craven intended that, but good job casting adolescents for this movie. By the way, what's the ratio in terms of women to men?
More common in men.
So,
Is it the same?
yeah, 1-to-1, which is wonderful because there happens to be 2 women and 2 men. Again, Wes Craven right on here.
I have a quick question about the multiple sleep latency test. Are they woken up enough to the point where like they're not able to be conditioned? Because what are they're constantly being woken up, but then their body gets like conditioned to like wake up before they get woken up because they know they're expecting it to happen. You know what I mean?
Yeah, no, I don't think, no, because if they have difficulty falling back to sleep, then the test gets terminated.
Okay.
But if they fall back to sleep, then conditioning has not taken place. So
No, I
either
mean,
way,
like,
it's a win.
they do fall asleep, but then they just immediately wake up because they expect the person to show up to wake them up. You know what I mean?
Yeah, no, I mean, again, if that happens, that could confound the test. And the individual may need to come back for another sleep study then.
Okay.
Yeah. And I don't know, I really don't know the extent of times that does happen, but I'm sure it could happen.
Because I don't know, it seems like, I mean, obviously it's done for a reason, like, because it works, but it just seems like it comes to a point where the individual is going to be like, okay, well, they're going to wake me up now, so I might as well wake up. You know what I mean?
Yeah. Usually, what happens though is that if they go back into sleep, you see this in a polysomnography. If they stay in stage 1 and 2, that's potentially problematic. But then again, if they stay in stage 1 and 2, that might be an indication of something anyway. So again, stage 1 and 2. Remember, especially in stage 2, what are the two clinical findings that are characteristic for stage 2 sleep?
Sleep
Sleep spindles and gay complexes. What are they?
I think sleep spindles look like.
They look like smudges,
Yeah.
right? So I'm glad you could identify them in an exam, because you can. What are they?
Are there moments of being like, I get really good on this unit in my class, and I don't know, like moments of something.
Brain
Sorry.
activity?
More specific.
Yeah.
Why?
Wait. I'll get
You're
back to
right.
that.
Why? Because the person's aroused. It's a micro arousal,
There you go.
right? So, I mean, something might go bump in the corner of your bedroom, and it's when you roll over. Okay. What's the K complex then?
A larger building?
No. The K complex is your central nervous system acting to protect you from waking up. Right? It is that internal mechanism that allows you not only to roll over, but then fall back to sleep. Right? So it protects from you processing any further stimuli while you're sleeping. Now, that may or may not result in you being able to go back to bed. If so, you're going to see that on the polysomnography. And of course, if it fails, you can get some beta activity and you could be awake and alert. So the waves that follow certainly will be consistent with what happens. Either you do get back to sleep and perhaps even into the deeper stages 3 and 4 sleep and see that delta activity, even REM, or not. But the K complex is that internal mechanism that the central nervous system basically turns on for you to keep out any further stimulus being processed. Right? So, again, and this might be certainly information that you would be interested in if there might be any conditioning taking place during a polysomnography, especially in MSLT. Any other thoughts about this particular patient, Nancy Thompson? Doesn't look like it's drug-induced. Doesn't look like it's due to an underlying medical condition. And it looks as if what she's demonstrating is actually consistent with narcolepsy of all things. She's hallucinating. What is the actual pathophysiology of narcolepsy, and does it fit into this plot? What is the polysomnography going to read? Beyond that decreased REM latency.
Is it a shorter amount of being in REM sleep as well, or?
Not shorter amount, but it definitely has something to do with REM sleep. The clinical term you will hear is REM intrusion. REM intrudes into other parts of your sleep cycle. For instance, if we had somebody with narcolepsy right here, and she had an actual narcoleptic episode, REM would begin now, right? And she might begin hallucinating. And she may have muscle atony, or she might actually have a drop attack, right? So that's the reason why we actually have these hypnopompic and hypnagogic hallucinations, because prior to the drop attack, you're actively dreaming when you're awake, and that's called a visual hallucination, to dream while you're awake.
You enter them without going through other sleep stages?
Yes. Oh yeah, it doesn't progress.
Yeah.
No, it intrudes, period. It can intrude any sleep stage. Yes.
Is this similar to the mechanism of sleep paralysis at all?
Yes. The sleep paralysis is part of REM. I want you to think of REM and sleep paralysis as the same exact thing. Sleep paralysis is only the component of REM sleep that results in muscle atony, ATONY. So here we have this nightmare, this dream, that intrudes wakeful states. I mean, this can't be a better metaphor than narcolepsy. Matter of fact, so briefly, let's get to its treatment. How do we treat narcolepsy?
Modafinil? Isn't it like a stimulant, modafinil?
So a stimulant like modafinil, stimulant like Ritalin, right? And even GHB, all of which will address the excessive daytime sleepiness. So probably scheduled closer to the morning, right? Excessive daytime sleepiness is a result of there being dyssynchrony with regard to your sleep cycles, and you just not getting restorative sleep. Because as all this is going on, stages 3 and 4 sleep will be compromised, and that is the deep restorative sleep. So you're going to wake up and you're not going to feel refreshed. And during the day, if given the opportunity, you could fall asleep. We've seen this with students all the time. Right? All of a sudden during my lecture, as incredibly energetic and stimulating as it may be, they're nodding off. Excessive daytime sleepiness. Right? Now, it's different than lethargy. Lethargy is simply feeling tired. Excessive daytime sleepiness, sure, it includes lethargy, but it also includes and is defined by that component that if given the opportunity, the individual falls asleep. Right? Excessive daytime sleepiness, stimulants, non-stimulant medications like modafinil, as well as atomoxetine. And then finally, even oxybutynin, which is GHB. In addition to that, what do you want to do? You want to give them something to disrupt REM. Right? That's the problem here, is REM. The problem is the abnormal dream. The problem is Freddie. What neurotransmitter disrupts REM? What chemical messenger disrupts REM? Sorry? Now, acetylcholine. Specifically, anything that blocks acetylcholine. So we refer to that as the anticholinergic side effect of medications. So if you give an anticholinergic medication at bedtime, that will solve the second part of the problem, because you want to disrupt REM. What medications are notorious for having anticholinergic side effects?
Antipsychotic?
Yeah, antipsychotics and antidepressants, and one of the older antidepressants, called Vivactyl, is commonly prescribed.
Would anticonvulsants do that too? Or not?
Now, they're more GABA, is a different neurotransmitter. We want an anticholinergic. Acetylcholine, that is, sleep is a cholinergic phenomenon, so anything anticholinergic will disrupt sleep, specifically disrupt REM sleep. That's the goal here. So the older tricyclic antidepressants have fairly significant anticholinergic side effects. And it's interesting because during that sleep study, she specifically asks the tech, can't you just give me a pill? And he quickly dismisses her, but if you really answer that question or address that question, the answer is yes. Right? And as soon as she REMs within 21 seconds, 23 seconds, that sleep tech should have thought about that. But I guess he was too focused on that hat that she pulled out. Any other observations here?
I mean, maybe some of it is like trauma related because of some of the scenes where like she's laying, in, especially the infamous one where she's laying in the bathtub, and that's like where one of them.
Are you going to allow me to break the first rule of Fright Club? If I have your permission, I'll go with this one.
Okay.
Yeah, I mean, I think that Freddy is definitely sexualized. I don't think there's any doubt about that. Whether it's the bladed glove in a bathroom, whether it's what happens over the phone, Freddy Krueger is absolutely sexualized. And by the way, who was Freddy Krueger? Yeah,
Serial killer.
he was a serial killer and he's a pedophile.
Yeah.
Right? But he was allowed off. He was found not guilty due to technicality and was hunted down by a vigilante group. We talked about pedophilia, we talked about paraphilias in the previous hour. We're not going to repeat those. But certainly Freddy Krueger, the man, certainly has a paraphilia. It's a pedophile. What about Mrs. Thompson, Nancy's mom?
She's a very concerned mother.
She is very concerned. What's the object of her concern? What's going on here?
Well, her daughter refuses to sleep, is constantly taking stuff to not sleep. The boyfriend, people are dying, the boyfriend is terrible, blah, 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 blah. Concerned mother.
Concerned mom. So concerned that I'll post this as well because I actually counted the number of scenes that she's actually drinking.
Oh, that's right.
And it's greater. It's significantly greater than 50%. I think it was 68% of the scenes she drank. So now again, major teaching point, clinical pearl. Quantity has nothing to do with alcohol use disorder. Again, when I tweak the link to the Clippity Clop video, you'll notice that acronym Clippity Clop does not include anything with regard to number of drinks or duration. And that's a clinical pearl because if you believe somebody has a problem drinking, and if you discuss with them their heavy drinking that is impacting, whether it's their medical condition, their psychiatric condition, etc., very frequently they will tell you, I don't drink every day. And even though you'll never reply to that saying, oh, that doesn't matter, you'll do so much more professionally. You have to make sure they understand and are provided that psychoeducation. Nonetheless, she is drinking in significantly more than 50% of the scenes in this movie, and there does appear to be interpersonal dysfunction that may be a direct result of her drinking. Matter of fact, her own daughter calls her out on it. So, alcohol use disorder in March. Is that related to the trauma at all?
It could be because didn't she and her husband, weren't they involved in the people that that came after Freddy Krueger?
She said we.
Yeah.
I didn't know she meant that euphemistically, or she.
I mean, I read like a summary of it too, just to because I've watched the movie a couple times, but just to point that out. It does say that in the summaries that they were part of it. So I guess people interpret it as.
She had his blood.
Oh yeah, that's right. That too, yeah.
I mean, unless she just
Is that
collected-
odd?
That's odd. Yeah.
Is that odd? There's something else that happens during that scene too that struck me as odd. Anybody? This is the scene where she breaks the news to her daughter that there was a child serial killer.
Just got her affect is completely.
Well, she was also drunk.
Yeah.
Yeah, I mean, I'm sure.
She's like,
yeah.
oh, it's Fred. Blah, blah, blah.
Yeah.
I'm sorry. You nailed it here. Louder?
Oh, it's Fred. Blah, 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 blah.
Now again, I know this is a different generation, respectfully, all right? But when this breaks in the 1980s, and every day, every week, every year since, have you ever heard that fiend referred to as Fred? I mean, the world knows the monster as Freddy Krueger.
Yeah, that was to me when I heard that, I was like, no. But also literally in the beginning of the how is it called when they whatever. His name was not Freddy Krueger. It was Fred Krueger. Like, this person as Fred Krueger, and it was like something happened somewhere in the culture. We're calling him Freddy instead.
So what happened?
Maybe she knew him. Is that like what you're alluding to? Maybe?
Listen, you own it.
No, I mean maybe.
Go.
Or I was, but I think the other thing could be.
No. Go with that one.
Okay. So maybe, or not maybe. I guess now we're saying that definitely she knew him, and that probably drove. I mean, I'm assuming most of the neighbors knew him because they got so emotionally involved that they burned his house down. So, with him in it.
If she knew him, would that explain other aspects of this movie that are otherwise unexplained?
Yeah, it would, and it would also probably explain why she then is so like. Doesn't she like lock up the house towards that end part?
Mm-hmm.
So she knows that he is a very significant threat.
Mm-hmm.
But it is also interesting that like Freddy is normally the term of endearment, so the fact that like further knowledge of him actually formalizes his name a bit more.
Mm-hmm.
It's sort of like, oh, that's Fred down the street, instead of like, oh, that's Freddy Krueger.
Mm-hmm. Again, she's the only one I ever knew to call him by this name. Right. So the other thing that again may have just been something in the script and nothing to it, but now we have to reconsider is why Marge and her husband are separated. Because if you're telling me she knew him, if you were sitting in a clinical interview, this is not information you would hear and then simply dismiss and say, that's probably nothing there. As a psychiatrist, you must ask. Right? And if you're told no, and if there's nothing there, it's perfectly fine, but boy, you must ask. We have a situation here in which a parent of someone who right now is having nightmares about a sexual predator is disclosing to her daughter that she knew him. And by this disclosure, refers to him by a name that no one ever refers him to, suggesting some level of intimacy. And then we realize that she's separated, if not divorced from her husband, and we've got to put this together.
Is it possible that as a child, our friend Fred had a fun time, you know what I mean? Did something to her as a child, but she doesn't really remember it, but I guess subconsciously. Boom, we're done.
Yeah.
End of movie.
And what evidence now was proposed in this movie to actually support that?
Could it be that at the end of the movie what happens? Like that he, like right at the end of the movie comes after her?
You know, this is the only character that he takes his time with. The other three adolescents die very, very quickly. He tortures her. And even from a different perspective, looking at psychopathy, looking at sociopathy, there's a reason for that. Okay, I'm not going to get into forensics, but there is a reason for that. And it might be actually what you suggest. The other thing is that we know that she's having nightmares and flashbacks. Remember, in the beginning of this movie, upon her first, quote-unquote, first nightmare, she's in an English class, English Lit. And she is zoning out and has a flashback. And that flashback is down a basement. Right? And I wonder if it's her basement. And I wonder how long Freddy was living in her house. Possibility, if not probability, but one that you would inquire about if you're a clinician. That's the bottom line here. You'd have to ask.
It's so weird because I remember Halloween as a kid, some other kids would dress up as Freddy Krueger, and I'm like, now thinking about it, like, wow, these parents really let their kid dress up.
I'm not sure many people would actually understand that, though.
Yeah.
In their defense, unless they're listening to our feed right
Yeah.
now. Now they're probably got an aha
Yeah, well,
moment.
hello if you're listening.
How does Nancy get herself out of that dissociative state in that English Lit class?
Somebody,
I don't think so.
She like woke up screaming.
She wakes up screaming. How? Remember the scene?
She like moved all the way back to
She burns herself.
Oh, in the dream, yeah.
How do people with past sexual trauma who go into dissociative episodes come out of their dissociative episodes.
Like self-harm or
Self-harm. Right. So again, I think Wes Craven left some Easter eggs here for us to put this together as a film that is much more than just a nightmare. Right. If Nancy truly has nightmares, and she likely does, it looks to be in the context of a larger disorder, and that probably could be post-traumatic stress disorder, especially if she's got a trauma history. If she was one of those potential victims, perhaps one that escaped, or maybe never abducted, but had the pedophile living with her when her father moved out, Uncle Fred.
Thinking about it a little bit more, maybe her mom is so, I guess I'm insulting the mom now. Her mom is so frustrated with her daughter because maybe her mom like agrees with Freddie, like maybe her mom is also like low-key a pedophile, but it's just not,
You think that
doing anything about it.
even if you removed it from the house, did Freddie act alone?
What if they like were a team? You know what I mean? Like, what if they were? There was a reason why they were together before.
I would have to look at the movie yet again. Now, specifically looking for evidence to support that, because that again, that's a trope. We've seen this before, where again in Scream, right? Spoilers. That this does happen. And by the way, Scream was written by Wes Craven, so this would not be the first time he would suggest that.
or at least she enabled the behavior, and that's like another.
I think she enabled it, which is why she feels so guilty,
Yeah.
which is why she drinks. She drinks to forget. So I think there's some clinical relevance to that. But if you want to go into a deep dive and think that there was actually more to it, and they actually acted as a team, I'd have to watch, because that's a very interesting rabbit hole to go down. One I don't mind actually going for.
Have you ever considered the mom, I guess, like a victim of Freddy Krueger? And that she was
Sure. I mean,
right?
right? We talked about this the last hour.
Yeah.
Stockholm syndrome in the mom. Stockholm in the mom. All right. Before we end this, I do want to talk about some or a medication that we might consider here. Right? Individuals who suffer from the symptoms that Nancy is suffering from, these dissociative episodes, may be assisted or helped with Naltrexone. So this is a mu opioid receptor antagonist. That is, it binds to the mu opioid receptor and it blocks it. And since the episodes of dissociation are mediated by naturally occurring opioids, that might be one way to improve or get through the dissociative episodes, rather than having the patient cut or burn themselves. Right? So Revia, R-E-V-I-A, is the brand name. In addition, we, I think, all agree that Nancy is suffering from nightmares. Prazosin, an alpha agonist, is often used for nightmares in this setting of post-traumatic stress disorder as well. So those are two medications that we would have to consider. Now, if we actually diagnose a disorder, narcolepsy, we talked about the stimulant, anticholinergic combination, certainly there are additional FDA-approved medications for PTSD as well, if she in fact does rule it. But I wanted to make sure I just mentioned Prazosin and Revia as a couple of options for the medical management of her specific symptoms that might be in the context of PTSD.
And if she does have PTSD, could that mean maybe some of the like sleep episodes, like especially when she was in the classroom, maybe she wasn't asleep, maybe she was having like a flashback that like she kind of froze, like was in like a catatonic state instead
I
of
think
being
so.
asleep?
I want that second camera to give us a look about what she was doing. Was her eyes open, or was she actually sleeping? Because we're taken into what we think is a dream, but it might just be a flashback. It might be a look into her mind, and it might be a flashback. I don't know. I have to actually look. Now, even if her eyes are closed, doesn't necessarily mean she's dreaming, right? All right, we'll end it there. Big goodbye to our folks at home. Oops. Hang out one more second. I have one more thing to cover here.